Our first thesis of the evening is entitled, The Dark Side of the Rainbow, the Case Against Conversion Therapy. Please welcome Daniella Hernandez.
It was 2000 in England. George was 17 years old when he checked off on a questionnaire that he was a homosexual. The questionnaire presented to him was for a new youth group he was attending. George was excited to be a part of the church since he had grown up in a Christian household. Little did George know that one checkbox would be a start of a roller coaster of experiences. The next day, the pastor asked to speak to George. With a stern tone in his voice, he encouraged him to go to conversion therapy. George agreed to go, although he wasn't sure what it fully entailed. The next few years for George would be ones he would never forget. What is conversion therapy, and does it actually work? Would it allow for him to find a place within the church? Conversion therapy is a system to treat same-sex desires invoked through behavioral therapies, such as snapping a rubber band on one's wrist when they have homosexual thoughts. Harsher methods include electroshock therapy, forced viewing of heterosexual pornographic images, and even corrective rape. Conversion therapy focuses on one-on-one or group setting treatments to fully convert one's same-sex attractions to the appropriate sex. Conversion therapy is founded on Skinner's work on behavioral therapies, known as operant conditioning. Operant conditioning focuses on punishment and negative and positive reinforcements as a way to condition a specific behavior. Conversion therapy used Skinner's operant conditioning as a way to prevent patients from engaging in their same-sex attractions by punishing them. Christians favored this method because of biblical teaching affirming that homosexuality is a sin. Various places in the Bible, such as Leviticus 18 and Romans 1, assert the act of homosexuality as an unlawful sexual behavior, instead upholding romantic relationships between a man and a woman. Since homosexuality is a sin, then why not conversion therapy? Although Christians must not legitimize same-sex lifestyles, Christians must not support conversion therapy because it is ineffective and traumatizing. The first inconsistency lies with the fact that those in the conversion therapy circle argue it provides a complete modification, when in fact, it provides no fundamental transformation. According to a study done by Weill Cornell University, 87% of participants who have undergone conversion therapy have found it unsuccessful. Further, a small percentage to find it successful have admitted to lying in order to stop receiving treatment. Treatments performed in these centers are mentally and sometimes even physically damaging to an individual, such as being electroshocked daily. As a result, patients lie that the practice is working on them to get out of punishment. The other percentage to find it successful have concluded that results last for a few years, then resurface. Take, for example, the president of the most famous conversion therapy organization, John Paulk. He was caught exiting a gay bar and confessed to reverting back to same-sex attractions. With people like Paulk and many others, it is clear that conversion therapy is ineffective. The second part of the controversy lies in the fact that practices that attempt to alter same-sex attractions are seen as healthy, when they are threatening forms of treatment that mentally and physically damage a person. The University of Los Angeles reported that those who have undergone conversion therapy are 92% greater odds of committing suicide or being depressed. Imagine being drugged each day to endure long hours of electroshock. Imagine how damaging that is to your body. Why then are we supporting treatments that harm a person's body? Those who favor conversion therapy look to Matthew 5:30. And if your right hand causes you to sin, cut it off and throw it away. It is better that you lose one of your members than your whole body go into hell. So, if the Bible is telling us to cut off any part causing us to sin, then why is conversion therapy wrong? The common misinterpretation with that verse is that those who favor conversion therapy translate the verse to its literal meaning. However, the verse is not meant to be translated literally. Instead, to show us that our sin is rooted within us. We cannot cut off any part causing us to sin because that is not the problem. The real problem sits within us. Behavioral therapies cannot fix that issue. Only God is capable of rooting out that desire. That is why he calls us to abstain from our desires, that way we're no longer feeding into them. Therefore, desires like those are rooted so deep within us that they cannot be fixed through behavioral therapies. Further, behavioral therapies practiced in conversion therapy are explicitly taught against in the Bible. A common form of therapy is forced viewing of heterosexual pornographic images. Practices like these are seen as sinful, selfish desires that are urged against in the Bible. Christians have no place dealing with this sin, and they definitely have no business enforcing others to do so. Sadly for George, there was no happy ending. Each day he attended conversion therapy, where he was called unlovable and often trolled by church leaders how they could see the demon inside of him. Each week, he endured long hours of grueling exorcisms. George became depressed to the point of attempting suicide. Luckily, his attempts failed, but lives with the damaging effects conversion therapy has left him. Moving forward, we can be better Christians by no longer invalidating those attracted to the same sex, but instead inviting them in. The church must hold understanding counseling sessions for those facing this sinful desire, educating them on the Bible's position on homosexuality and what it means to fast from their desires. Although it is hard to help those with same-sex attractions, one thing is clear: conversion therapy is not the answer. Thank you.